Since I've had telehealth installed, I've not had to go to the hospital.
The evaluation that we did at 6 months showed that we had, on average, saved 1 emergency admission per patient.
Telehealth is the best thing that's ever happened to me.
The railway industry was extremely important to Swindon. It brought people up from London, up from the smoke, and from all over the country really, to come and work in the railway industry. Obviously you've got, asbestosis and all those diseases associated, unfortunately, with the railway industry. So we ended up in Swindon with a high proportion of people who had the potential to have respiratory disease, basically. And when we looked as a PCT at how many people were going into hospital and with what, we realised that COPD was the number one. That meant we were having a lot of unplanned admissions to hospital. And when people with COPD get into hospital, they often stay for 11 days or so, because you could have people going in with a chest infection and needing quite a lot of input from the acute services. So we needed to look at a really good way of managing or helping to manage those people at home, and this telehealth equipment came around.
Once a patient takes their daily readings, those readings go down to our single point of access, which is based at Clover Unit at the Great Western Hospital. The actual readings are read by a nurse practitioner on a daily basis. If there's a problem with those readings, so the oxygen levels may be out of the parameters set, that nurse then rings the patient, has a conversation, advises. If it's a more serious condition, then the community matrons are asked to go out, see the patient at home and implement whatever care is required.
My name's Violet Carter. I suffer from COPD and I also have scoliosis of the spine. Makes it difficult for me to breathe. My breathing's got worse, so I'm not on oxygen, as you can see, and this is the pendant. Since I've had telehealth installed, I've not had to go to the hospital, in hospitals. I've not had to go to outpatients appointments, which saves a lot of time for me and also for the hospital doctors. I can monitor my health, and if I have any problems, then they get in touch with me and tell me. I think it's a very good thing because it gives me peace of mind, and it also gives my eldest daughter, who looks after me, a peace of mind, and she can go to work knowing that I'm all right. And when it does go off at 11 o'clock, it takes my pulse, my blood pressure and my temperature. That way I can keep an eye on how I am, how my body is, and if I do feel a bit rough, but the signals are good, then I know it's just going to be one of those days. If not, there are people I can get in touch with.
Since Violet's been on the RTX monitor, what we've found is that she's become more confident, is able to recognise the changes within her health. We've been able to do prompt treatment. She's now able to administer her own emergency drugs, which we keep in the house, and overall it's given her a much better quality of life, to the point where she actually this year went on a week's holiday with a family member. Within Swindon PCT, we started telehealth monitoring in 2007. We are now rolling out the new RTX monitors, and we will be going up to a total of 250 monitors. We currently use predominantly the monitors with patients who have COPD, but we will then be elaborating on our current monitors to diseases such as diabetes, coronary heart disease. Since using the RTX monitor, what we have found in some cases, we've made diagnosis of hypertension, diabetes. We've also found that there's been poor compliance on medication, and we have been able to improve that.
The evaluation that we did at 6 months showed that we had, on average, saved 1 emergency admission per patient to hospital. But for me as a nurse, the best thing was the actual quality of life benefit for the patient.
Since using the monitors, we have definitely seen a reduction in hospital admissions, also GP call-outs and outpatients appointments.
I would recommend telehealth to anybody. Kim comes and sees me once a fortnight, my district matron, and just to make sure that I'm okay. But if I do need her, I can always get in touch with her. I can always phone her, which is good because I feel safe. And telehealth is the best thing that's ever happened to me.